What is a CEA baseline level in colon health? What exactly is a CEA baseline level in the context of colon health? A CEA baseline level refers to the initial measurement of carcinoembryonic antigen in the blood. This test is typically done before any treatment for colon cancer or related conditions. It serves as a crucial reference point for monitoring disease progression, treatment effectiveness, and potential recurrence of colon cancer over time. Carcinoembryonic antigen, or CEA, is a glycoprotein that is normally produced in small amounts by cells in the gastrointestinal tract, including the colon. In healthy adults, CEA levels are generally low. For non-smokers, normal levels are typically below 3 nanograms per milliliter. Smokers may have slightly higher normal levels, but it is important to note that elevated CEA levels can indicate the presence of colon cancer and other cancers. The baseline CEA level is significant for several reasons. First, it establishes the patient's starting point before treatment begins. Elevated baseline CEA levels, particularly those above 5 nanograms per milliliter, are often seen in more advanced stages of colon cancer. In contrast, early-stage colon cancer may show normal or only slightly elevated levels. By tracking CEA levels over time against this baseline, healthcare providers can detect cancer recurrence or progression. When interpreting CEA levels in colon health, there are a few key points to remember. A normal baseline is considered to be below approximately 3 nanograms per milliliter in non-smokers. Levels that are slightly elevated, between 3 and 5 nanograms per milliliter, may require further evaluation based on clinical context. Elevated levels above 5 nanograms per milliliter often warrant further investigation to determine the presence or progression of cancer. Very high levels, such as those exceeding 10 nanograms per milliliter, can indicate extensive disease or metastasis. However, it is crucial to understand that CEA can also be elevated in non-cancerous conditions and among smokers. Therefore, the baseline measurement must be interpreted carefully, alongside clinical findings and other diagnostic tests. In summary, the CEA baseline level in colon health is the initial blood measurement of carcinoembryonic antigen. This measurement is primarily used to assess the presence and extent of colon cancer, guide treatment decisions, and monitor response and recurrence. While it is an important tumor marker, it is not a standalone diagnostic tool, especially in the early stages of the disease. Always consult healthcare professionals for personalized medical advice regarding CEA levels and colon health.